Good afternoon and welcome to another edition of Wonderful Wednesdays with Wendy. I am your host, Wendy Wotecki. Today we have my friend Kelly King from the PEAL Center, and she's here to talk to us about navigating physical and behavioral health systems today. And that is a really huge hot button topic right now because it's getting a little bit more complicated. Things have changed. We've got COVID slapped in there. So welcome, Kelly King.
Thank you so much. It's a delight to join you as always. And when you say that's a big issue, we've got a lot to talk about today. So hopefully I won't be too speedy in my speech and make it difficult to understand. It really can be very complex, but I hope I can help to make the complex a bit simple for you and to better get a grasp of, some of these systems and how they interconnect to make your life a little bit easier for you and your children. And so, as Wendy said, I am Kelly King. I'm the Family to Family Health Information Center Coordinator at the PEAL Center. And when I think of healthcare and I deal with healthcare, I like to say it's really, really thin, but it covers the whole state. But anytime you're talking about children with special health care needs, virtually everything that they deal with in their life would fit under the Maternal and Child Health Bureau expectations for me as a family-to-family health information center coordinator to deal with, helping you with. So that goes everywhere from financing to working in the community, navigating these systems. It's very, very broad. And hence, I get the opportunity to come and join you more frequently to talk about some of those wonderful topics. So we are going to be, as Wendy's opening up that slideshow, we'll be talking about navigating some of those health systems and really want to focus that around the mission of the PEAL Center, which is, very much like mission and power to make sure that individuals are included as much as possible. I mean, our children with disabilities are just somewhere on the range of normalcy, whatever that means. And they're just, they just want to be normal. I hear them so often say, you want to go up to slide share, Wendy? While you work on that, I'm going to talk a little bit about, what I intend for you to get out of our time together today. So I'm hoping that you'll be able to, first of all, identify services and funding systems. And you're certainly going to recognize some of them with the ones that individuals that you work with use. I hope to also explore some of the eligibility criteria and then think about, what are some of the unmet needs that people have and how can we plug them into these service systems? And then I also want you to, be able to name some organizations that could help you navigate these systems. So, if you're not calling me, who else can you call that might be able to give you some direct help? I just wanted to ask, anybody that'd be willing to contribute, who helped you to navigate some of the systems, just for yourself or your child, perhaps. For me, it was a lot of other families, but maybe somebody has a different idea. Anybody have an idea or willing to share who might have been a helpful person in navigating a system?
I know for me personally, it was other families. And then once I started working for Mission and Power, it was a lot of research. And I called the PEAL Center a lot to find answers.
Great. Sometimes physicians are helpful or care coordinators. Some people get linked up to an Elks nurse. Sometimes that starts at early intervention, or maybe somebody at the school is helpful. So always a lot of great ideas about possible people who can help. Think of Pennsylvania and some of the systems that are involved there. Certainly healthcare is a big one. Education, you can't get through school without going through the Department of Education, and maybe you used early intervention. Maybe you use, health insurance through the Department of Human Services. Maybe somebody has some waiver funding. When we think of the Department of Health, there are some Title V funds, which are channeled through the federal government that fund some specific things, but they also target some needs in the state. So monies are channeled through them. There's certainly a population of children with special needs who are dependent on some type of technology, so some of those funds are channeled there. Then under human services, as I said, most of our children are eligible for medical assistance, but with medical assistance, you know, you're talking about equipment, some of those therapies. Usually you go into managed care unless you're one of the few in the state who qualifies for the HIP, the Health Insurance Premium Program. And then that has to do with whether it's cost effective for the state to put you into a managed care organization or not. And then many of you may take advantage of the Medical Assistance Transportation Program that gives you a little bit of reimbursement to go to a medical appointment, and or they might provide a riding service. There's also the Office of Mental Health, and many of us will be familiar with the Behavioral Health Rehabilitation Services, the wraparound, which has recently changed, and you'll see the bottom of that category. It's the Intensive Behavioral Health Services now. The Office of Developmental Programs, that's where our young people get their waiver services. And of course, as I said, we can't get outside of education because everybody has to go to school. And at the end of education, you're often involved with the Office of vocational rehabilitation to get some training and to help to secure a job. But underneath that, you'll see I have the Office of Aging. You think, well, what is that doing here with, you know, these services to help with disabilities? In fact, our young adults who have disabilities go through the Department of Aging, because it also includes disability services in there as well. So that's often who you have to call to get the services that they need. And then of course, each of these has some monitoring and oversight that is usually contracted out to a vendor to take a look at things and make sure that they're doing the job they've committed to do. So, you know, a lot of complexity here. And if you think about it, they're quite a bit like silos, aren't they? And it would be nice if there was one right door to get in and access all these services, and that they were interwoven and blended and like fabric, you know, they really fit you nicely, but it isn't like that yet. I think that's ideal, but the reality isn't there. If we could go back to the PowerPoint slide, Wendy. So when you just think about those services as Wendy's moving back, you know, who's eligible for services under which of those silos? And what does each of them provide? What is it that the different services provide under each system? And then can you double dip? Can you take something from here and something from there? And in fact, that very often is the case. So imagine a young adult who's, you know, getting continued education and taking advantages of services through the Office of Vocational Rehabilitation. They may also have medical assistance, and they may have waiver funding. So it's more than maybe double dipping. You can pick services from various different of the silos, and then they may be getting something through the Office on Aging additionally. A really important thing is different types of insurance. So many people have forms of private insurance, which you could get through your employer, or maybe you pay for that and get something through the Affordable Care Act. And that's fine. A lot of other people use public insurance. And of course, in Pennsylvania, our Medicaid is called medical assistance. And then there's also CHIP, and those are public funded. And if you have both, the problem with that and navigating that system is that if you have a private insurance and a public insurance, you've got to go to some provider who actually will accept both of those. And your private insurance is always the first payer. And some providers, you know, do not accept medical assistance, so you're not going to get that covered if you go to them. And then there are nuances about paying for things if you don't go to somebody that takes that. So I had a family call me the other day. They actually had TRICARE, our military insurance, and they couldn't find anybody who would take that and their medical coverage. So I'll tell you in a minute what I did for them. And so with our medical assistance in Pennsylvania, it's actually divided into two pieces. One piece is the physical health, which also pays for medication. The other piece is the behavioral health. So with this physical health, you'll see the state is chunked up into regions. That's primarily due to population size. And each of these regions in the physical health plans has a number of providers you can pick from. Usually there are 3. And each of those managed care organizations has a special needs unit. And basically, if you think you have a special need or you think your child has a special need, you can call them and take advantage of that service. And they've got a long list of jobs that they're supposed to do to help you. So once in a while, they make a home visit. Sometimes they're on the phone with your doctor about a situation. Sometimes they're on the phone with a pharmacy. Sometimes they're participating in a meeting, or they're trying to coordinate appointments that you have down at some specialty care clinic. Sometimes they're trying to help you with an appeal. So they have lots of different jobs that they're responsible for. So that's the physical health side. And if you'll go to the next slide, there's our behavioral health side. And for the behavioral health, you don't have a choice. The county actually makes an agreement with one of these providers, and they provide them, so you have to use the one that your county decided to deal with. And we'll talk about some of the services they provide, but that's where you would get your intensive behavioral health, your outpatient, your hospitalizations. These are the people that are paying for that. Go ahead to the next slide. And an important aspect of the behavioral health that I'd like to point out to families, I worked in behavioral health, and often somebody would walk in and they'd say, here's your treatment plan. Well, it doesn't work like that. You're supposed to be a part of that. So if you see the CAS principles, they're really outlined at the bottom. It's the Child and Adolescent Service System program. It's been around for decades, but the principles are that it's supposed to be family-centered, child-centered, and family-focused, and then should happen in your community. That inclusive piece that I mentioned in PEAL's mission, and that Mission Empower believes in. The systems are all supposed to be involved and supposed to be least restrictive. And that is the foundation of the behavioral health services in our Commonwealth, as it should be. So if your child's provider isn't measuring up, or they're not involving you, there are some nuances when your child becomes a teenager and they have a voice of their own, but you should be involved and give voice to the services that they're receiving, and be involved in that treatment planning process. Go ahead to the next slide, please. I believe I've talked to you before about some of the home and community-based waivers. Mm-hmm. And the waivers have to do with providing services primarily for people after they're 21, and it's especially important for people who have physical disabilities and need nursing services. Imagine a young person with epilepsy that needs nursing services, and they turn 21, and those hardy services that medical assistance has provided for children, called EPSDT, Early Periodic Diagnosis, Screening, and Testing. Screening, diagnosis, and testing, I mixed up the words, are now gone. Those stop when the individual reaches 21. And so that nursing stops. And it's not unusual that I get a call from a family who's frantic and says, what am I going to do? We're losing our nursing services. So you don't want to wait till the last minute to look into waiver services. The intellectual disability and autism ones that are there on the column on the left are arranged through your county. So you want to call your county mental health and intellectual disability office. Some of those have actual titles, and make sure you're registered with them so they know that this is somebody who might need services in the future. And each of these has different criteria, and the services are different, and of course the amount of money that they provide can be different. So the PFDS, the Person Family Directed Support Waiver, the first one there, has a $33,000 limit with some additional funds for employment help. And then, they go up from there, but you can't just jump into a consolidated waiver generally. And those have do not have a monetary cap, but they also pay for different things that are going to cost more. And then the community health choices, the one on the right, is managed care for a lot of people who start out under when they get to the age of 21, it's pretty much a managed care organization. So they move into that when they're dually eligible for both Medicaid and Medicare. And if you have questions about that and you want to go into more depth, give me a call. My number's at the end. Go ahead to the next slide, Wendy. So again, the importance of waivers is that they're going to provide services in your home or in your own community, and keeps you out of a more intensive environment like a nursing home or a hospital. And I already said, school ends at 21, EPSDT ends at 21. So what do I do now, kind of a thing. Waiver services are very important. And unfortunately, you're not entitled to them. So you're entitled to school, and you can have that until you're 21 or you graduate, but that's not the case with waiver services. And I just put a little site there if you want to find out more how to contact your county. There's the site there. You can just do a search there for put your county name in, and then Office of Mental Health, Intellectual Disability, because phone books I don't think are existent anymore. So just a little pointer here. Entitlement is basically you meet the criteria and you get it. So I always have people stand in a line. I say, if you have your blue jeans, line up. And so everybody that's in line gets a candy bar. So you miss out because we're not doing this live. And then I have you sit back down and I say, if you wear glasses, line up. And here I am, there are 6 people in line, but I pull out a couple candy bars. So I only have 3 candy bars in there. Okay, that's all the candy bars I have. Sorry, you miss out. But it's a very practical way to understand this. You do meet the criteria because you wore glasses, but I ran out of candy bars, so too bad you don't get any. Well, then there are waiting lists, but the waiting lists are long and you have to wait till those slots open up, and sometimes that means you wait till somebody passed away so that you can move up. But the line isn't straight, and sometimes say Wendy's got a situation that's more serious than mine. Maybe her family died, or maybe her mother had COVID and had to be hospitalized and she can't be at home anymore. So she bumps me out of line and she gets the waiver services before I do. That's pretty much the way it works. So you have to meet the criteria, and legislation establishes that criteria. And, again, it's great that you meet the criteria, but if there's not money to pay for it, you're not going to get it. Go ahead to the next one. Go ahead. Oh, thanks. So there are some changes at 18 and 21, and they are really important to understand because everybody's going to get there sooner or later. So as I said, that category that sometimes called the loophole, that category of medical assistance that our young people got because they had a disability that met the Social Security criteria for children, is now going to be gone. So they have to get medical assistance some other way if they're going to keep that. They were getting perhaps some Social Security, or they were eligible for that under their parents' income and resources. Now they have to be looked at again with a different kind of glasses. So it's not what their disability is, but are they able to be substantially gainfully employed? And so it's considered differently when they become an adult. And so some people who had SSI as a child are going to lose it when they become 18, or vice versa. And of course, all those things with, growing up, the kids and adult, they get to make all these decisions on their own, which kind of leaves mom and dad out of the picture. So if you want to remain in the picture, think about some of those tools to get that done. So there's the legal processes and systems about they have the right to make their own decisions, even if they go off to college. So my younger son graduated from high school when he was 16. So that fall, he started to college when he was 16. So he graduated a year early. But as soon as he started college, FERPA kicks in, and I wasn't able to be told anything about his college. So they don't give you grades, you don't get anything because he's a college student. So if you want those things, sometimes you need a power of attorney. There are cases where guardianship is valid if the young person can't He doesn't have the capacity to make those important decisions about themselves, but you're going to be out of the picture if you don't do something about it. So just keep that in mind. Holding on to medical assistance is really important after an individual reaches 18. I said the PH 95 ends, but there are other ways to qualify. So if you're eligible for SSI, you do get to continue to get your medical assistance. So that's like part of the package of SSI. And they actually, I put a little footnote down there at the bottom, so don't fret. They actually continue until high school graduation. Oops, I got an of instead of or. That should be or 2 months after the 19th birthday, whichever one comes first. So it's not like as soon as they turn 18, they're going to lose it. And you don't have to be too frantic about that because they'll hold on to it for a little bit. But the biggest way that people get medical assistance is because of their income. So if they are a low income individual, and of course, kids are generally not working if they're still in high school, so they're going to be able to hold on to it. There's also something called MAWD, which is Medical Assistance for Workers with Disabilities. And that could mean my work is, I come over to my neighbor's house and feed their dog, and I get $5 a week, but that's a job. And so you pay a small amount of your income in order to maintain that medical assistance. And medical assistance coverage can be really, really valuable. Maybe you work at a place, but the employer contribution to your insurance and the deductibles and the copays take such a chunk of your money that based on your medical needs, it may make more sense to hold on to medical assistance, which has very hardy coverage and you don't have those huge copays and deductibles. So MAWD is a way that you can get it. And then of course, you got to balance that with not having too much money because that can kick you off of medical assistance. And so how do you protect your savings and your money to maintain your Social Security or your medical assistance? And that's not such an issue with MAWD because you're contributing to that. But just very important considerations. You don't want to have too much money and kick you off. And then of course there are always denials of services, and each of the managed care and the HIP, the Health Insurance Premium Program, have ways to appeal if there are denials or reductions. And the important thing here is that you need to do that in 10 days from the date you have your letter to stop that from happening. Basically freezes the action until the appeal, and then that decision can be made. And there are different levels of appeals. As I said, the special needs units could be helpful with an appeal, as could the folks from the Pennsylvania Health Law Project, and I have their number at the bottom for you as a resource. So, these are important things to know. Read those letters, read the detail, understand the different processes and levels of, of a problem and how to appeal that. So if you need to get there, you're prepared to do so. And then take a look at actually what is it that they're denying about, because that's the thing you want to target. So some of the additional supports that medical assistance provides, as I said at the beginning, medical assistance transportation program only covers medical appointments. They're not going to take your 3 other little children or your little brothers with you if you have to do a ride program. They are going to send you the cheapest way, and they will send you to the provider who's closest. So you may have to get, like if you want to go to a specialist in Pittsburgh and there's one in Erie, they're not going to send you there unless your doctor writes a note that says this is the closest provider that's appropriate for this situation and the needs of this individual. So there are ways to work around it. Of course, with COVID, lots of people have been able to take advantage of the SNAP, the Supplemental Nutrition Program, and actually the income level on that is pretty high and pretty convenient. So take a look at that. It's been a relief to a lot of people. And then the TANF is the temporary assistance. It's cash assistance. It doesn't last too long, but again, it's been a lifesaver for so many people along the way. Go ahead to the next one, Wendy. And as I said, the individuals with disabilities, when they become adult, go into the aging department, and in Pennsylvania it's known as the link, and it is designed, but doesn't always work, as a seamless approach to assist people with disabilities as well as those seniors in their activities of daily living. The Elks Nurses, I like to describe them as the best kept secret in Pennsylvania. They help people with disabilities. And what I really love about the Elks Nurses is that they work on a very small level. Again, it's population based. Some of them have multi-county, some of them have part of the counties. But that means they know about the things in Erie, or they know about the things in Crawford County, and they're more familiar with them and people there who can give you the help and the support you need. And what they do too is a lot of care coordination. They're not doing hands-on nursing, but I have seen them, because the little boy has a disability, and mom and dad are in the house, and they're helping grandma because grandma helps or watches the boy some of the time. So it's more than just specifically helping that child. They may be helping the family more extensively, because in doing so, they're helping that child with a disability. Go ahead to the next one. So the Centers for Independent Living offer a lot of support and advocacy. Don't ever hesitate to reach out to yours, even if it's just, hey, what can you do for me? The idea is to support people so that they can live independently in their communities. A lot of people have difficulty with transportation, especially more in our rural counties, and they may have resources for you to help with that, because you got to be able to get from place to place. And with that in mind, one thing I wanted to mention with that and the medical assistance transportation program, a lot of people have benefited from telehealth, because they can see providers without having to physically go there. Now, again, it's a balance. There are limitations. Okay, they can't check my pulse, they can't check my respiration, they can't do this and that. Now, there are tools that they can use that even can attach to your phone to do some of those tests, but our doctors don't have those very frequently. But it's given a lot of people access to specialists they would otherwise not have been able to see, because they can now have choice. And if you lose your transportation, say you had a ride to go somewhere and it falls through, telehealth is a really nice way to get that done, and it saves you a lot of time and trouble. And maybe that just means getting from one side of Erie to the other side of Erie, but when you think of what goes into packing up, transportation, maybe getting somebody to watch some other child, I mean, that can be a challenge. So telehealth can be a real benefit to people. And then if you have an interest in going to work and you have a disability benefits counseling, and they will have a conversation with you about how that will work and how much you can work and how much you can bring in before those benefits that you have are compromised. So don't hesitate to take advantage of them. They're there for you. Go ahead to the next one. So the Maternal and Child Health Bureau objectives, which drive not only the work that I do, but the work that the state does through the Department of Health, a couple of them are important when we think about systems. And, how do the services in our state measure up to what the federal government anticipates for us and our loved ones? So are we as family members able to be partners in the decision making about our children? And if we were all here live today, I'd have you do like a fist to 5. So 0 is like, no, they're not doing a very good job, to 5, wow, that is exceptional. So what do you think, Wendy? How are you experiencing things with being a part of making decisions? Can you give me a fist to 5? What do you think?
I'm gonna give it a 3.5.
Oh, 3.5. You're gonna like do a little bent finger there. Okay. And then, how about being satisfied with services that you receive?
I think we could do better. I think telehealth, like for me, telehealth clogged it up a bit. And being that my child's younger, they're not being very responsive to telehealth. And we were on a 2-year wait list for a certain service, and they gave it to us gladly in telehealth, but it has a disconnect for what we need. So, but you don't want to turn that away, because we're hoping that we don't drop off somewhere. We're like in
Sure.
black hole, I guess.
Oh, that's
So,
unfortunate. We need to throw you a rope down there, but I think that
yeah.
the idea of a black hole is like you get sucked in, right? So how do we rescue you from the black hole? But that's really very important to, it's not measuring up, and it doesn't always measure up. And so the last one I'm asking, the community-based service systems, are they organized in ways that you can easily use them? And maybe this isn't in the midst of a pandemic, but generally, are the ones in your community workable?
I think so, but I also think that there is an odd, unusual disconnect because everybody's always like, um, we have I think 3 or 4 different centers, and you hate to just when they start picking and choosing because you don't have TSS here but you do here, and you have mobile therapy available here but you only have family based here, and so then you're starting to get all these different agencies involved, and they're not allowed to talk to each other, and it just gets really, really funky monkey. So I
Yeah, it
think
sounds messy, and like things aren't measuring up for you where you're living and in your experience. Got some work to do there for sure.
it's a hiring issue too. I think that when they switched everything in mental health, I think they just kind of like stopped everything for a hot second, and hopefully everybody's hiring now, and hopefully with all that will come in some better and more well-rounded services and availability. I'm hoping.
Yeah, and unfortunately, I think that happening, that transition during a pandemic, made it really problematic because it was difficult enough for the TSS worker who had a few hours of school here and a few hours there, and like trying to eat their lunch while they were driving from place to place, and then
Hmm.
when those kids weren't in school for that period of time, like there's no money coming in,
They had to
so
get
what do
jobs.
you, that's right, so, and then having to amp up your training to meet the criteria for the intensive behavioral health, and to do that job meant those people were maybe established somewhere else, and there was no turning back. So yeah, it's not been smooth, but again, with everything, we've got some work to do to improve these systems. So thank you for sharing. I really appreciate that.
Yeah, I think it'll get there. It's gonna be a hot second. And then like you said, I didn't even think about that COVID end where we lost so many people because there were no hours. So that's true. And I know a lot of little ones did not do well with telehealth.
Absolutely not. And we talk about the Zoom overload, but it's a reality. They just didn't want anything more to do with that, if they wanted anything to do with it at all. Hey, this is a picture of Care Map. A woman was asked to create, to share information about her child and the care that they're receiving and the challenges. And if you look at that, it's divided into some of these systems we've been talking about. And if you look, you say, oh my goodness, wow, this is complex. But if you really had to do one for your own child, you'd see you're probably not, things aren't much skinnier for you. So it can be a little complicated. And I like to think of it even as, maybe a spider web, because shouldn't there be some connections between some of those systems where we link them together from one to the other? And that just makes it even messier. But it's a lot to coordinate, and I think the value of a care map, which are used in a lot of healthcare settings. But if you created one of these, you could take it out with you to your doctor's office, to your educators. It's not about wanting people to feel sorry for you because you've got all this mess to deal with. Imagine if you have 3 children, and there are visuals with 3 children with special needs, and the complexity in trying to juggle all that to get their needs met means you could use some help. But another beautiful thing about this is there may be some duplications that somebody can help you to point out, and or at those transition times, maybe when you're going from early intervention into school age, or you're graduating from school going into adult healthcare, somebody can look at this and say, hey, this is missing, or these are some important things we need to think about right now and make sure we put in place. So it's a very nice visual tool. And if you're interested in that, we'll do another session about creating a care map. How about that?
I was gonna say
Go
that
ahead.
actually could be really good.
Okay, skip that. This just describes it. Go ahead to the next one. And now I think of, the transition age and all of the considerations about adult wellness, and especially in light of COVID, the social and emotional, the mental health impact that this has had on people, the fact that, you couldn't go out to the gym, you maybe can't even go to the park and get your exercise, and how this has impacted people financially. And, when I speak of the spiritual, I'm not necessarily speaking of faith, but perhaps a community of faith, but it's just your general sense of peace and meaning and purpose. And, unfortunately, the way mental health has been impacted, and the suicides that have increased, these are all really important factors. And unfortunately, with COVID, we've been unplugged from so many of our supports to keep ourselves well in these areas, that as things are opening back up again, just look at this and say, what am I missing, and how can I get back on a good trajectory in this area of my life, or my child's life, or our family life, to make some improvement in this area. Go ahead to the next one. And when I talk about trajectory, I get that from here, and that's the life course tool, which was born out of one of the F2Fs. And it's often used in the Office of Developmental Programs and woven into plans for people who have waiver services. And the whole idea of it can be used at any time in a person's life. If you see down there at the bottom, there's a baby up to senior citizens. And the idea is that there's a plan of some things that you want in life and some things that absolutely are repulsive to you, because I'm not you and you're not me, and we don't like the same things. And I might like to live in a rural community, but my goodness, you got to be in the city, or the suburbs are great for you, or you like this activity, but not that one. So it's important, in order to get where we want to go, we have to kind of think about a path. And so, some of that is about, we've got all these systems, we have an idea of what we need. And as I told you at the beginning, those systems in my chart are kind of like silos. And so here are the silos down there at the bottom. If I'd put little caps on those, you'd have thought that we were at the farm, right? But how do we put bridges together in those silos? How do we, throw the rope to pull people out of their black hole, which looks a lot like those silos there, Wendy, doesn't it?
Mm-hmm.
And give them the supports they need, where they need them, when they need them, so that we can navigate and meet people where they are, so that their outcome will be improved, and they'll be maximized. So anything you picked up, anything you learned, how can you use what I've told you? Because this is just a lot of interesting information if you can't use it in any way. Any ideas?
Well, for me, I think I'm gonna have to go and look back and see where we're missing the boat as far as what insurance and how we're gonna do the insurance, because our daughter is adopted, so she has Medicare, Medicaid. We don't have CHIP, but we also have that ability to potentially put her on our private insurance. And so does private insurance get us any better therapies than her access card? So that's interesting to me. And then once again, trying to figure out how to get your services coordinated a little bit differently and a little bit better and more support. And then of course we have some other people in the office that I know have children that are transitioning into adulthood, that are going to need those waivers for living, I believe, on their own. So how do you even start approaching that? So it's a good map for us to start to follow.
Great, good.
And get some answers.
I'm glad to hear that. Listen, don't hesitate, and I'd suggest for all of you who have children with special health care needs, or work with families who have children and young people with special needs, to make that coordinator, that case manager at your special needs unit, a good friend of yours. Have them on a hotline, because some of that coordination of services is something that they're responsible to do. It's in their contract, and call on them to do it. And if they're not doing a good job of that, call me, because then I'll tell you who you can call at the state who supervises them, and we'll get it straightened out. So for example, there were people who had children in school settings who lost their nursing services, and the provider said, well, that's not going to work. And they'd call the special needs unit, and then still, there were barriers. And after they'd called the special needs unit, I gave them the number at the state. It was one particular insurance company. It got resolved. So, you know, sometimes we have to go up that chain of command to get things fixed, but it's important to make that outreach to them. And you can find them simply by flipping your card over, calling the customer service number and asking for the special needs unit. Good way to get it. Go ahead. We'll just give you a couple resources here at the end. So there's a directory of the managed care organizations. I think the special needs units might be listed there. If you need more information about waiver services, the HICSIS is a great place to get that. CAST coordinators, there were originally one in every county. They were to develop the infrastructure. They can help if there are a bunch of services that need to come together, say, you know, mental health and education and maybe juvenile justice or other things. They can pull people together. This is our National Family Voices website, and there's just a lot of resources there for anybody. I told you about the Life Course, there are a couple of places there. Pennsylvania Medical Home has a lot of great resources for families. And then the Pennsylvania Health Law Project that can help you out if there's any issue with any type of public insurance.
Kelly, I want to thank you so much for coming and teaching us and sharing with us about the navigating physical and behavioral health systems, because it is a complex, overwhelming topic if you are a parent and you don't understand, for instance, me, like how does Erie County Care Management coordinate with behavioral health, CCBH services coordinate with, you know, how does it all work? So this kind of explains it a little bit better. I like it.
You know, once it's out there for you, if you need help navigating, call one of those resources, call me. We can always have another conversation, but you've got the information, so now you're responsible to do something with it.
I love it. I love it. Thank you for coming, Kelly. You have a wonderful day.
You too, and sorry about all those technological problems.
Hey, we try.